how do you treat a stroke?
So basically, Olga, when you have a stroke, basically what you do, so again, you need to get to the hospital as fast as possible, right? So when you get to the hospital, you're going to go into a stroke protocol, for example, and then depending on how long ago the stroke happened or started, you may be a candidate for the IV clot buster medication called IVTPA. Okay, that's the first step. The problem is that depending on how bad your stroke is, or depending if you do have a large vaso-occlusion, only the IVTPA may not be enough for you to treat you. So then, you may be or not. Sometimes people are not candidates, but if you are, then we take you to the cath lab, to our angio suite, where we basically do like a catheter procedure, based procedure called mechanical thrombectomy. So basically what we do is we navigate a catheter through your groin or through your arm, get there where the obstruction is, where the clot is, deploy like some devices there or aspirate that clot and remove it. So that works in about 80% of the cases.
Fantastic.
And if it does, about like 50% of those patients will do very well and go back to be almost like completely normal.
All right, fantastic. That's what we want.
So that's the ischemic, that's the ischemic type of stroke, right?
However,
there's the hemorrhagic type, which
we're going to talk about in our next segment.
Okay, perfect.
Yes. No, but please continue.
Well, the hemorrhagic type, really, like the first thing that we need to do is make sure blood pressure is controlled if it's a blood pressure problem. If it's an aneurysm, then, we go through like all an evaluation, and a lot of times we need to treat that aneurysm as fast as possible. And most of the places when you have a ruptured aneurysm, the way it's going to be done, it's going to be done also through a catheter, but instead of like opening the vessel that is blocked, like we do for mechanical thrombectomy, for ischemic stroke, basically what we're doing now is we're getting a catheter inside that aneurysm and plugging it with little coils that basically block the blood flow inside that aneurysm. So basically we're stuffing that aneurysm. And the other way to treat those aneurysms, if you cannot have it done like through the catheter, you may also be a better candidate for a different procedure called surgical craniotomy and clipping of the aneurysm, where basically a neurosurgeon does the craniotomy, opens your skull and put a clip at the base of the aneurysm. It's a little bit more invasive, but some patients could be good candidates for that. So those are the two different ways to treat if you have a ruptured aneurysms.